Good evening, everybody. This is Dr. Tamkeen. May I know who's presenting today? Please let me know on the WhatsApp group so that you can be made one of the presenters. One is Dr. Tripti Sinha. Neha,
Yes,
can you
ma'am.
see Dr.
Yes,
Okay, Tripti is there. Who else is presenting today? Dr. Dr. Kavita, who's presenting from Grey Group. Hello. Anybody? Can they unmute themselves and talk, or raise their hands? Please raise your hand if you are there.
Yeah, tell them to raise hands, ma'am.
Yeah, please raise your hand if you are there. Those who are presenting today, so that they can be made panelists. Hello. Please raise your hand. Dr. Tripti, are you there? Dr. Tripti is there.
Yes, ma'am.
Okay.
But I can't see anybody else.
And you have joined as what? The name is not showing.
Tripti Sinha.
Can you see it, Neha? Okay. Now she's
Yes, ma'am. She's in presenter, ma'am.
Okay.
Staff member 3, ma'am.
Yeah, I can see now. So those who are presenting today, please raise your hand so that we can make you the presenter, or type in the WhatsApp group so that we can see. Yeah, Dr. Archana
Singh.
Dr. Archana. Dr. Archana.
Ma'am, I'm making her the presenter. Wait.
Okay. So I unmuted her, but why I couldn't listen to her?
Ma'am, now you will be able to, ma'am. Just
Okay.
a sec. Yeah, now she will be able to speak.
Okay, Dr. Archana. Good evening, Dr. Tripti.
Good evening, ma'am.
Dr. Archana, please unmute yourself by clicking on the microphone icon. Please, I think she unmuted and she again muted herself.
Dr. Archana, please
Yes,
unmute yourself. Please unmute yourself.
Oh, ma'am, she went offline.
Okay. So anybody else who's presenting is there, please raise your hand so that we can make you the presenter.
Ma'am, Rupa Vani.
Okay. You can see her hand. Yeah. So please make her the presenter.
Made, ma'am.
So there, 3 people are going to present today. They have all been made into presenters.
Ma'am, but Dr. Archana
Went offline, yeah.
Ma'am, now she's in attendees, Archana Sinha. But ma'am, she's not
That
raised
was
hand.
Dr. Archana Singh, I think. That was
Yes,
not Dr. That was Dr. Archana Singh. Let her join back.
Yeah.
So Neha, if we make everybody, there are 24 participants now. I just want, can we make put everybody into the panelist? No.
No, ma'am.
What difference will it make? What difference will it make?
I mean, there's a limited number of people who can be made panelists, and you will be making them presenter one by one.
Okay.
So all those who are going to speak or those who are going to moderate, they are placed in the panel. The others, all others are attendees. I mean, we can make about at the maximum about 12 people in the panel.
Okay, and then when they are in the they are the attendees, we can unmute all or at the same time so that anybody can talk. No, that facility is not there. They have to raise their hand,
That
and then we have.
facility, yes. I mean, though we can press unmute all button, but then that it becomes very difficult to manage then.
Okay.
It's not like Zoom that everybody is all the time muted. They can unmute themselves. Here, I mean, we can do the same thing manually.
Okay.
And there is one request. If we have too many cameras on, then the speed becomes slow, then sound starts giving problems.
Okay.
So generally, the rule should be that those who are speaking, their cameras should be on.
Rest of them should keep their cameras off. Yeah.
Yes. So I'm shifting towards the CBME
Yeah, I know.
ENT also.
Yeah.
Okay.
You have another this thing.
Yes.
So can we start? Dr. Hemant is there. Dr. Anjali is there. Dr. Amita is also joined. I think we can start.
Ma'am, there is one hand raised from Dr. Malathi.
Okay, she's one of the presenters.
Ma'am, do we need to ask her before that?
Yes, Dr. Malati, can we join? Dr. Amita, yeah. Yeah, Dr.
Yeah.
Amita. Dr. Amita
Should
wants to say something.
I'll unmute myself because I'm not presenting, madam. I'm Malti.
Okay.
I'm Malti. Yeah.
So who's, I thought you were presenting from your group. Who's presenting?
Yeah,
Okay.
I'm presenting. Somebody else has put their slides, so I'm just asking you when I can present.
You're presenting,
Actually,
you're presenting Malti, so you will be one of the okay. Neha, did
Okay.
you note that? She's one of the presenters.
Yes.
Okay, ma'am. Ma'am, she's in attendees only, ma'am.
Okay, can you just shift her to presenter? Neha, Dr. Malti.
Yes, ma'am. Yes, ma'am.
Neha, I would also like to read this session on uterine fibroids because Dr. Tripti consulted me about this, and I have got some feedback to give here. She is presenting the yellow group.
Madam, voice is breaking.
Dr. Amita, we
Ma'am,
can't hear you.
Ma'am, I have made Dr. Amita panelist.
Okay.
Ma'am, and as well Dr. Malati also.
Okay.
And rest no hand is raised, ma'am.
Okay. So there's just 3 presenters today. And so Dr. Amita, we can't hear you.
Can you hear me now?
Yeah.
Yeah, I just wanted to give my feedback on Dr. Tripti's slide because Dr. Tripti has been so enthusiastic about presenting, and she wanted to know this, that. So it was really very nice interacting with her. And it would be nice if Dr. Tripti does her presentation first because I have a lot of other commitments after this. That's the only thing I wanted to tell.
Okay. So, Dr. Tripti, Dr. Amita, can we start now?
Please.
Okay, Dr.
Please.
Tripti.
So shall we start? May I start, ma'am?
Yes, Dr. Tripti.
Yes,
Am
please.
I
Yes,
audible?
yes.
Yes.
I'm Dr. Tripti Sinha. I belong to the yellow group of the CBME fraternity. I'm working in the Department of Obs and Gynae in Shri Krishna Medical College in Muzaffarpur. I've been allotted the competency of uterine fibroids. Sorry for this. In the MCI document, it is numbered as OG 29-1, and the defined competencies to be acquired by the undergraduate students who are to be taught fibroid uterus. They are supposed to know how to describe and discuss the etiology, the pathology, the clinical features, the differential diagnosis, the investigations, the principles of management, and complications. We would basically be testing the domains in knowledge, in their knowledge about uterine fibroids, but there would be some emphasis also on psychomotor skills regarding the how they examine the patient, as well as communication skills when they counsel patients of uterine fibroids. So the level of competency would be from knows
Your
how
slide.
and shows how.
Dr. Tripti, hello.
Yes,
All
ma'am.
panelists, please mute yourself. All panelists, there's some disturbance. Please mute yourself, number one. And number two, Dr. Tripti, your slides are not moving.
Yes, my slide is not visible.
It's visible, but the first slide is there only. It did not move.
Oh, but it's moved on my screen.
Okay, so some network problem. I don't know about others.
I'll do that, ma'am.
Are you able to see my second slide?
No, it did not move for me. Others, please give your feedback.
It has not moved, Dr. Tripti. It has not moved.
Ma'am, please, Dr. Tripti, please do it now. Please share your screen.
Has it moved now? On air,
No.
showing screen. It's hello.
Yes, it has moved. It has moved.
It's moved now. So
Yes, yes.
MCI, CBME undergraduate. Is this the slide that's showing on you?
Yeah, curriculum specifications.
Yes.
Yes. So I'll just go through it again. It's numbered as OG 29-1. And when we teach the students fibroid uterus, we would like to cover the aspects, how to describe and discuss its etiology, the pathology, the clinical features, differential diagnosis, the investigations concerned with diagnosis and the management, the principles of management, and the complications associated with fibroid uterus. So this would be covering the domains basically primarily of knowledge, but at undergraduate levels, we would also like to test some psychomotor skills and communication skills of the students about how they talk to patients about the diagnosis of fibroid uterus. The level of competency expected from them would be mainly knows and knows how, and some elements of shows how. And it is a core competency of the undergraduate syllabus. Did it move? Hello?
Yes, it moved, Dr. Tripti. Yes.
So audience would be target students in phase 3 of the undergraduate years, and they would be mainly in the 8th and 9th semester. Teaching teaching learning methods would be both large group teaching, in which we give didactic lectures, and it would be nice if we made it a bit interactive to hold their attention, and small group teaching, which would be possible clinical teaching in the OPDs where patients first comes in, then inpatient wards both in the pre-op and the post-op period, and also in the operation theater while we are operating for fibroids, so we can show them some steps of the operation as well as the different types of fibroids which we will be telling them. Shall I move ahead?
Please move ahead.
Yes, assessment would be both in the written exams, the long and short essay questions with objective questions, which could be of multiple choice questions or true or false choices. Clinical examination, we would assess how they take history, do a general examination, and how they perform an abdominal examination. Internal examination, we don't expect undergraduate students to do. In the Viva VOC, we would expect them to discuss the specimens, and very often we also have photographs we took at the time of operation, and we show them also of the different types of fibroids removed at operation, and they could be asked to describe and to describe the type of fibroid and to relate it to clinical features of the patients. Then OSCEs would be to assess the counseling, how students counsel patients on the treatment options available to her, including myomectomy. So this slide is basically a repetition of the different aspects which have been given in the MCI document about what are the different aspects we have to cover. So starting with the learning objectives regarding etiology, we usually deal with SLOs under A, B, C, D. A will remain the same as audience, so I haven't mentioned it in the subsequent slides. And B for behavior, C for condition, and D for the degree to which we want the undergraduate student to have acquired the competency. So with etiology, we expect them to enumerate and describe at least 2 etiological causes or factors for the development and growth of fibroids. And the domain tested would be knowledge, and the level would be knows these factors. Types of fibroids, again, we would ask them to classify or categorize fibroids on the basis of their site in the uterus and the presence and absence of a peduncle in a given case being discussed, and they should be able to do so correctly, which is pedunculated where the fibroid is sited, and so on and so forth. And again, we would be testing the knowledge domain to the level K. In pathology, the student should be able to discuss the macroscopic and microscopic features of fibroids with emphasis on the benign nature of fibroids. They should have very clear concept that this is a benign nature as opposed to other pelvic tumors which are very often malignant. Again, the knowledge domain is being tested to the level K. Complications, you have to enumerate and describe at least 5 important possible complications which can occur in uterine fibroids. There are more than that, but if they are able to enumerate the 5 most important ones, they would be given credit for it. And again, it is a knowledge domain to the level K. Clinical presentation, we expect those students to enumerate, describe, and explain the symptoms and signs in a given case. And they should be able to enumerate. There are many symptoms and signs. At least 5 important common symptoms of sign is what we would expect them to know. And that would be D. Knowledge domain, and again the level should be knows and knows how. They must know why not only this symptom is present, but why this symptom is present. They should be able to explain that also. And they should also be able to compare and contrast the symptoms and signs of different types of fibroids in the same or different patients. Because in the same patient, there may be multiple different types of fibroids, each presenting, each causing different symptoms and signs. Or there may be patients with completely different types of fibroids who will present with different symptomatology. And why this symptom has occurred in this patient and not the other, they should be able to give the reasons correctly. So again, it would be knowledge domain to the level of knows and knows how. When we are teaching them fibroids, we should also be able to assess their teach them clinical skills about they should be able to demonstrate how to perform abdominal examination on a patient with a lump in the suprapubic region. That would be the condition for this learning objective. And we would be this because we have already tested their knowledge, and this would be testing their psychomotor clinical skills. And the level would be knows how and is also able to does it. So that would be shows how. This got stuck.
You click on the arrow of the PowerPoint. Yeah, must be on the left
Can
side.
you see it now, ma'am?
Yeah.
It has moved on my screen.
Yeah, it has moved.
See it now?
Yeah, it has moved.
Yeah, it is visible.
So again, another important consideration when we teach fibroid is the effect on pregnancy, because fibroids have a propensity to affect the reproductive age group women. So that becomes an important consideration, and undergraduates should be able to enumerate as well as explain 2 effects which pregnancy has on fibroids and the complications in pregnancy due to fibroid, and secondly, what the effect of fibroid is on the pregnancy. They should be able to enumerate and explain at least 5 effects which fibroids may have on pregnancy, which can adversely affect the pregnancy outcome. So in both these aspects, we would be testing their knowledge domain, and also they should be able to explain. So it would be the level of knows how also. Differential diagnosis is very important. How to they must know how to differentiate between 5 different causes of enlarged uterus before they finally are able to say that yes, this is a case of fibroid uterus, but it could be so many other things. So enlarged uterus, which would be the condition, and they should be able to enumerate at least 5 different causes, and they should also know what are the specific characteristics of the other causes, so that they can finally come upon the diagnosis of fibroid uterus. Investigations, they should be able to list and categorize 5 investigations in a case of suspected uterine fibroid. So this would test their knowledge domain to the level K, and they should also be able to interpret the results and reports of the investigations in a case of suspected uterine fibroid correctly. Again, the knowledge domain to the level of K and KH would be tested. Principles of management. Final year students in the 8th and 9th semester should be able to demonstrate an understanding or explain in a given case what was the rationale and what is the mode of action of the different modes of treatment available to that particular case. It could be either conservative, medical, surgical, or any of the newer modalities. So this would be the degree, and they must be able to correctly discuss which treatment is suitable for that particular case. Knowledge domain to the level of knows and knows how. And affective and communication skills could be assessed by seeing how the student counsels and discusses the treatment options for a patient with uterine fibroids, that particular case, and whether he is able to do it correctly in the context of the patient's condition. So this would be again knowledge domain, as well as it would be also the affective domain. I think I missed writing that. And the levels would be to the level of knows how, and also shows how to talk to these patients about their condition and the management which they are going to receive. I think that's the last slide, ma'am.
Okay.
Hello.
So anybody, can we just go back to your first slide, and then we review them with the attendees? So does anybody want to make a comment from among the participants?
This is my first slide.
To your first slide, yeah.
Yes. This is what the MCI document has given.
Yeah, next.
This
Okay,
is
next.
the audience.
Okay. So would anybody like to comment on this presentation? We want more comments from the participants. Please raise your hand. I will unmute you. Yeah, Dr. Malti, you want to say something? Okay, no. Dr. Malti, no. Please raise your. Dr. Uma Gupta wants to say something. I unmuted you, Dr. Uma. Dr. Uma, I unmuted you. Dr. Uma, are you there? Dr. Pushpa wants to say something. You are unmuted, Dr. Pushpa. Dr. Pushpa, I unmuted you, Dr. Pushpa. You can unmute and talk.
Yes. Every time Madam has mentioned that enumerate 5. So every time it is not necessary that every time it is going to be 5. Sometimes it might be less, sometimes it might be more. So in this, whatever is the number or whatever are the differences, for example, or whatever are the symptoms or effects on pregnancy, for example.
So I was exactly thinking the same. Like Dr. Tripti, you have written 5 causes of enlarged uterus. What do you have in mind? I won't also remember, apart from pregnancy and a fibroid and maybe a adenomyosis.
Sorry, ma'am, you're talking about?
There was one SLO that you made, enumerate 5 causes of enlarged uterus.
Yes, ma'am. This differential diagnosis.
How to know? 5 different causes of enlarged uterus. So
Yes,
what
ma'am.
5 causes? Yeah. Maybe 5 causes of suprapubic lump the student might be able to enumerate. But 5 causes of an enlarged uterus.
So you suggest that I change enlarged uterus to suprapubic lump.
Yeah, maybe that would.
No. Can I come in here? Can I come in here?
Dr. Amita,
Yes, ma'am.
definitely.
Yeah. No, Dr. Tripti, you are absolutely justified when you say 5 or 6, which you thought were the common ones. That is fine. I mean, perspectives can change. That only 5. That is a discussion between gynecologists to say which are the common or which are not the common. But your breaking up these competencies into SNOs has been fantastic, because you have absolutely explained audience, behavior, condition, and degree. Now, the condition or the degree can differ from institute to institute also, and it will also differ from student to student. If a slow learner can tell you 5 causes, I think it is more than enough. And we ourselves have to come to a consensus as to which are the common 5 causes we want our undergraduates to know, or maybe 3 causes, or even maybe 10 causes if we find. So this is quite relative to the subject concern. But when we talk about breaking objectives, breaking competencies into objectives, this has been done quite comprehensively by you, quite comprehensively. And I think as regards this, as talking about as a gynecologist, enlarged uterus, are you talking about enlarged uterus meaning more than the period of gestation? Are you talking about that? The uterus size, or more than the period of gestation, are you talking about that? Or are you talking
No,
about
ma'am.
a enlarged uterus as such? That means a
Enlarged
gynecological.
uterus.
Yeah,
Yes, ma'am.
because
Enlarged uterus, and
pregnancy
in
complications
this
as
the discussion would follow whether this patient is pregnant or not pregnant. So
So
whether
if
the
you have
patient,
that in mind, if you have that in mind, then it is then it is an appropriate to put 5
yes,
causes.
yes.
But you have, like Dr. Amita says, the basic concept of how to construct the LO, that is absolutely clear on your part. But the thing is that when we are talking about a degree, it has to be real according to the phase of the student, isn't it? And the standard. Maybe there may be minor differences between institutions, but the main purpose of having a CBME is that there should be standardization. And if somebody says this person has done MBBS from India, maybe, so it should be absolutely, you get a message, you get a message which is very clear that if the person has been certified that he's fit to practice, then he has attained a certain level. Okay, but here if you want to keep the 5
yes,
causes of an enlarged uterus, then you have to mention pregnant and non-pregnant both, isn't it? So that there is no confusion in the minds of the student. Because being a teacher, I also got confused, and not only me, the doctor, that was Dr. Who was the other doctor who just raised that point? So that is,
Dr. Pushpa.
yeah. So it should be clear both for the teacher and the student. What is our aim? Number 1. Okay. So any more comments, Dr. Manjit
ma'am,
Mahi?
may I put in a clarification,
Yeah.
ma'am?
Yes,
Like
please,
I have
please.
written enlarged uterus, so that would be a way of testing whether the student has taken his history comprehensively, and to stress the importance of the student asking the last menstrual period, because if that patient has missed periods, then the first differential diagnosis would be a pregnant uterus unless proved
All
otherwise.
right. So you are absolutely right. I agree. So Dr. Manjit
So
Mahi,
Yes,
yeah.
I just wanted
Yeah,
to
that's
reiterate
fine.
that
That's
as you
fine.
mentioned.
We understood. I understood that is what the purpose you had in mind. So that is fine. Only thing maybe in this one, you just put
I just
in brackets of enlarged uterus, keeping
yes,
pregnancy in. You can just put it in brackets.
Keeping pregnancy. Yes, ma'am.
Yeah,
I just wanted
that
to
would be
convey that there is a lot of repetition of knowledge,
Dr.
domain, and
Manjeet
everything.
Mohi.
Yes. So I just wanted to say that every time there is a repetition of knowledge, domain, and everything. So can we just let it be a small part? Hello?
Sorry.
Hello, am I
We
audible?
didn't get you. Yeah, we could understand your comment. Please, can you repeat, Dr. Manjeet?
I just wanted to convey that there is a lot of repetition in explaining domain, criteria, and everything. I think once she is given in the first slide, what is it, knows how, every time, are we supposed to write in every SLO?
No, I think because for the sake of presentation, she has made it that way.
I think
So
also
that-
so. Yeah, you could keep it in your mind and not write it down. If you
Yeah.
know the whole competency is this much, you could keep it in your mind. No need to write it down. But if you want more clarity, okay, fine. Because actually in the beginning also when she had made her slides, I had asked her, the audience will be the same. So don't keep on repeating the audience. So audience or the A remains the same, and then we can go in with the BCD. Is that what you wanted, Dr. Manjeet?
Yes, ma'am. Definitely.
Yeah, but that may be something that you, okay, this is we can categorize all those together into knowledge, all those together into knows how, all those together into shows how. That we can do. That may be just a way of putting it in a more organized way. But the basic concept is clear, should be clear.
Dr.
I did given it, madam, just so that we are clear about every SLO, how far we want the students to know what is the level. Therefore, I've actually written it repeatedly.
Right,
So,
right,
Dr.
right.
Just
That
for
is
the sake
fine.
of clarity.
Yes,
Dr.
yes, fine.
Dr. Pushpa, are you there?
Yes.
Yes, Dr. Pushpa.
Yes. Similarly, regarding 5 investigations. So sometimes there might be more investigations.
Madam,
Absolutely. There might be more investigations, absolutely.
At least 5
But
investigations.
yeah, that may
Again,
be we can brainstorm and see what we want what minimum requirements we want from our students. That we can brainstorm amongst ourselves and we can send messages that, okay,
Yes,
I
yes.
want or we want at least these 5 investigations for the student to know. That we can definitely do it. But just to
Yes, ma'am.
explain
And
the degree,
Doctor,
just to
at
I would
least
like
explain
5
the
to,
degree,
investigations.
yes.
Tripti, I would like to ask a question. What investigations did you have? 5 in, because you are putting a degree there. List and categorize. And what type of categorization did you want? Did you have in mind?
Ma'am, it could be categorized in 2 ways. One would be whether it's a biochemical examination or whether it is an imaging study. And
So how
again,
matter?
the blood investigations would be more for the purpose of management when we are taking her up for surgery or whether when we are considering medical management. And the imaging methods would be basically to confirm a provisional diagnosis.
Absolutely, we can just categorize the investigations into prognostic and diagnostic. So diagnostic will be those that diagnose the fibroid, and prognostic is whatever you need to manage the fibroid.
Yes, ma'am. That was what I thought.
Yeah,
So
absolutely. That's
And
maybe
add at least investigations.
we don't need to order investigations for many cases of fibroids. So why not order relevant investigations in a particular case? Because there's going to be a whole list of investigations depending upon the management you are planning.
Yes, ma'am.
What do we do in the OPD? We just do an examination and we confirm with the help of an ultrasound and we look at the endometrial thickness, that's all. Isn't it sometimes? And if she's asymptomatic, maybe we just don't order anything at all. So order relevant investigations in a particular case, isn't it? So
if you want to take it a step further, you could say diagnose it totally clinically without even any investigation. That could be one way, and then go on to investigations also. So whatever SLO you have in mind, you can frame it like that. So clinically diagnose a case of fibroid and confirm by investigation.
So when you
That
just
could
put
be
a
the
list,
vocabulary.
when you
Ma'am,
put a
in modern
May I?
modern day
Yeah.
practice, I think doing imaging studies is, I think, mandatory before we take her up for any sort of surgery or whatever.
no, that is
May I
only
comment?
if
Yeah, that may be a legal arguable point. Yeah, that may be a legal arguable point. Yes.
maybe that is
Hello?
what I said, because it depends upon the particular case, isn't it?
Yes,
So when
ma'am.
you
Hello?
put
Yes,
a
ma'am.
category
Definitely.
there, 5 investigations, isn't it? And maybe
Yes,
he
ma'am.
will list 5
Hello?
investigation, but not include some very relevant investigation in there. So all relevant investigations in a particular case would be a better way of putting it.
Yes, ma'am. Relevant investigations to confirm the diagnosis.
Okay, yeah, in
Yeah.
a particular, yes,
Hello?
definitely.
Hello?
So
Yes,
from
ma'am.
Dr.
Hello?
Uma Gupta, yeah, who's that, please? Please go ahead.
I am Pushpa.
Yes,
For example, a patient is a young patient with infertility, and we are
yes.
planning myomectomy. Then the set of investigations will be entirely different. That will include the investigations for infertility as well, including her husband's investigations. So that is going to make a lot of difference. Suppose we are planning myomectomy, and when we are
Yeah,
planning
you're absolutely
hysterectomy,
right.
Dr. Pushpa, I think there is there in the competency it says complications of fibroid.
yes,
So we could take that up as one of the complications or maybe of the fibroid and then elaborate on it.
yes, effect of fibroids on obstetric
Yeah.
career of the woman.
Yeah, you could name it as complications of fibroid, or you could say effects of fibroid, or that way,
Effect.
because that can we can take that as a separate. When we have so many, the competency is very large, very huge.
Yes.
So we can keep on breaking it up into SLOs depending upon what we want to teach our students. So if we
Exactly.
could take the infertility part as one of the complications of a fibroid. Because if you see in the real sense that if really the infertility, I mean the fibroid is contributing to infertility, you could jolly well say that it is one of the complications of the fibroid. So, and we can categorize the complications to those that happen in pregnancy, like red degeneration, and we can categorize those complications which lead to totally infertility. That can be another way of categorizing the complications, and then each of these complications can be discussed as a case-based scenario
Yes.
to make the student go to the knows how level. Am I making sense?
Dr. Amita, what we are talking
Yes,
here
ma'am.
is different. What I'm trying to say is that when you order investigations, instead of listing and categorizing 5 investigations, which we don't need for every case, so when we talk about this particular learning objective, it should be order relevant investigations for a particular case. That's it. Not,
No,
we are
I
not talking
understand that this was
yeah.
that is definite. That is definite relevant investigations. But this was answer to Dr. Pushpa's question as to the infertility part. I agree with you, Dr. Tan, that that relevant word has to be put there. But then this question came from Dr. Pushpa as to how do we put insert infertility into it and where will that dimension go? So that was in answer to that part of it.
Okay, thank you. Dr. Satinder.
Ma'am, may I put in a word?
Yeah, sure.
Yes, please.
Ma'am, you added the word relevant. So relevant would be come under D, isn't it? That would be the degree to which the student should understand, because there's so many investigations, but only the
No,
relevant
Dr. Tripti, you cannot put that under degree because relevancy will change from person to person or case to case or scenario to scenario. If you are in a PHC, relevant investigations would be those that are available in your PHC. If you are in a tertiary care center, relevancy would be where they are available, right? So it will vary, and also relevancy will vary according to the case you have, what sort of case you have. So I think for an undergraduate, we need to define certain points that these are the investigations that are mandatory to diagnose a fibroid.
Yes,
Only one investigation is mandatory to diagnose. Apart from clinical, it's the imaging, ultrasound. That's it.
Yeah, absolutely.
ultrasound. A good
Imaging
quality
is the
ultrasound.
mandatory. That's all.
So Dr. Trip, what I'm trying to emphasize is that whenever you put a degree like 5, when you are thinking in terms of assessment, you are again going to ask them about that, the same thing. So a student may put 5 investigations, but it may not include the mandatory ultrasound. So how do you mark?
The relevant.
The student lists only one investigation, and that student is more intelligent. That student says that it is just ultrasound is required for diagnosis. So your this thing becomes very difficult. Assessment becomes very difficult. That is what I'm talking from experience. Okay, Dr.
So
Satinder.
relevant word. So
Yeah,
relevant would be has to be inserted.
Yeah, though it is not
Why
a very
relevant?
good word for degree, but that is the degree that we are talking about here. And please remember, not all SLOs will fit into this ABCD mode. If you keep on looking for every SLO, you might miss some of those things. Okay, Dr. Satinder.
Hello, ma'am, am I audible?
Yeah, Dr. Satinder, you are audible.
First of all, I want to apologize for asking this question from such a learned team of faculty. Me and Dr. Sangeeta were having a doubt in our mind that we are making competencies for the undergraduate students and how far we are right in showing the competencies for the level of effective domain. I mean, the class of 250 students, we are not letting so much exposure of each and every student to the patient. Art is domain more right for the post than the undergraduate. We make the competency to the
There's
level
some
of effective domain also. Like
Dr.
in this,
Satinder,
yes.
Your voice is not clear. There's some disturbance. Please, everybody mute yourself. Those who have already answered, mute yourself. Yes, Dr. Satinder. You were talking, if I'm correct, if I've understood you correctly, you want to know why, how to include the effective domain here. No.
No, why? Not how. Why? Why to include the effective domain in gynecological case in these problems for undergraduate students? Are they needed? Are they needed for undergraduate students? Because even in the small group discussions, we have clinical subsets of around 50 to 60 students. I mean, how far we are right in making our LOs for effective domains for undergraduate students.
Dr.
They are
Satinder,
not directly going to. They are not directly going to counsel the patient. I mean, are they needed? The effective domain.
Dr. Satinder, what we are, you know the atcom module. What is the purpose of that?
Yeah.
We are preparing them for the ultimate role.
Okay,
for their final role.
Yes, ma'am.
That is the reason. So if they don't practice now,
okay, ma'am,
how can they do it when they are actually required to do?
It means in all competencies, we have to take the level up to effective domain in all. It means
that is the thing is that whenever you are making a competency, think
yes,
of all the of learning to be included and think of the higher levels of Bloom's taxonomy.
Okay,
that is our
Okay. Can I come in here?
Some we may not be able to do.
Okay. Can I come in here to answer a little bit of Dr. Satinder's question?
Dr. Amita, please don't say that. You're most welcome.
No,
Yeah.
Actually, Dr. Satinder, you have actually एक कहावत है हिंदी में, आपने दुखती रग पे हाथ रखा है.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
हाँ, क्योंकि हम जानते हैं we have 250 students and 7 teachers or 8 teachers. ठीक है?
Yes, ma'am.
That is what I think what you were trying to tell us कि हर student को हम कैसे effective domain समझाएंगे. Isn't it?
Yes, ma'am. Yes. Exactly.
Is it that?
Yes, ma'am.
Okay, I understand your concern very well, and I understood what you wanted to say, and that is of course the Herculean task that every medical teacher is facing now. But the thing is that these competencies and these domains and the levels to which we have to take these domains have been decided by the NMC or the
Okay,
MCI,
ma'am.
right?
जी मैम.
So there is
Yes.
not much say that you and me have in it, right?
Okay, ma'am. Ma'am.
बहुत ज्यादा हम उनसे बहस नहीं कर पाएंगे. They
ठीक
have
है, ma'am.
already given that. But
Yes, ma'am.
sometimes later we can convey to them that this is the problem that we are facing in implementing these things. Definitely.
Yes.
Acha.
Yes, ma'am.
Now coming to that, having said that, what we can do is, if not tell every student to do shows how, at least we can do a role play and make them understand at least till knows how.
Very right, ma'am. Very right. Yes, ma'am.
And then shows how का अगर मौका लगेगा internship में तो shows how भी हो जाएगा.
हाँ जी, इंटर्नशिप में हो जाएगा मैम, हो जाएगा, पॉसिबल है, बिल्कुल
पॉसिबल है, पॉसिबल है. अच्छा अच्छा, एक और बात, we have a student doctor program in this NMC curriculum.
Yes,
in that they have said that the student will keep on shadowing the doctor. So
yes,
in due course of time, that doctor will be counseling some fibroid patient about the modalities of treatment, etc. So the student will come to know about that.
Yes.
So
Yes,
at least that student will go up to knows how level, and then
yes,
we can test the student on the next fibroid patient to do some shows how about it also.
Yes,
that's
exactly.
the best we can do, and I can understand genuinely your concern with 250 students to bring them up to the shows how level is quite a Herculean task.
Yes,
It is. It
okay.
is.
So
yes.
much, ma'am.
Dr. Anjali Kanare, would you like to give your comments? I unmuted you, Dr. Anjali.
Yes, madam. My impression is also pretty much the same. Like, fibroid is a common gynecological problem, and as NMC and IMG want that after the internship, at least the doctor should be able to counsel the patient for what to do, what not to do. So rightly said by madam that this is how they are planning to develop. Maybe all 150 or 250 students will not be able to do that, but if we teach them, at least they will remember and realize that, okay, we need to counsel this particular patient in this way. I personally feel this is the way what CBME wants it to happen.
And that is the
Am I right,
challenge that we face. Absolutely.
Yes.
That is the challenge that we have to face. That is why we are sitting here. But it's very good that you raised this point, Dr. Satinder. Dr. Uma, Dr. Uma, I think her hand is also raised for a long time. Yes, Dr. Uma Gupta. Dr. Uma Gupta. I unmuted you, Dr. Uma Gupta. So, Dr. Uma, please unmute yourself and please talk. So she's probably not there. So, any more comments? Any more? Yeah. Any more comments on this presentation? So, if you please, can I make some comments, Dr. Tripti and Dr. Amita?
Yes,
the thing is that
Dr. Tamkin, don't please. You just scolded me for asking you permission. Now you are asking me permission.
sorry for that. Okay. So the thing, if you remember the introductory, 2 lectures, 2 sessions, when we discuss CBME, so it is always we decide first where the student has to reach, and then we go back to the assessment and the teaching learning methods. So Dr. Tripti, when you talk to me about your presentation, that is the feedback I gave you, but probably there was some communication gap between me and you. It always has to be first you decide where you want to take the student, and then you decide how you're going to do it. So you presented your teaching learning. Unless you have decided on the SLO, what you want to achieve for your student, you cannot decide on the assessment, you cannot decide on the teaching learning method. So supposing, I'll give you an example. Your aim, the SLO, is that you want your you want your student to be able to counsel a case of infertility prior to myomectomy. Okay. So how will you decide the teaching learning method unless you know that this is one of your SLOs? How will you decide whether you want to use a video film, or you want to use the student demonstrate actual counseling of a patient. So you cannot decide on that unless you have decided on your SLOs. So that is one very important point I want to make, because you presented the teaching learning methods and assessment, and the teacher will also be lost if we don't know what is the SLO. How do I decide? And that is the reason why for the last few years we have not been able to reach where we wanted our students to reach, isn't it? Because we don't know how much the student should know. So if I want to teach, I'm very fond of touching on the affective domain, I will do that. Another teacher will not do that. So it has to be very clear what all students should be able to achieve at the end of the session. And for after that only you will decide on the teaching learning method and on the assessment. So teaching learning and assessment may go side by side. You may decide on the assessment first and go to the teaching learning later on, or vice versa. But it is never about the SLOs that you decide the SLOs later on. Okay. And it's very good that you put on that lesson plan slide also, because sometimes what I'm seeing that when I'm just translating the competency into the SLO, I'm restricting myself to particular SLOs, and some very important points that I need to discuss with the student are not there as part of the SLO. So that is why I'm also, whenever I'm doing that, I'm keeping the my own original teaching plan as a teacher with my experience. I'm keeping that in mind. So that also we have to keep on, just because we are all new to the method. So anybody else, can we move on to the next presentation? It is almost half an hour now. Oh, it's almost 1 hour now, but it was very interesting, to discuss and to listen to everybody's comments. Can we move on to the next presentation then? So can you stop sharing? Who's the next presenter? Dr. Neha, are you there?
Yes, ma'am, I'm there. Please let me know whom I have to make the presenter.
Just hold on. Dr. Rupavani. Dr. Rupa, are you there? Dr. Rupa, she's unmuted.
Ma'am, I've made her the presenter, ma'am.
Okay. Dr. Rupa, are you there? And the third, I think Dr. Malti is there. Dr. Malti, who's the next presenter?
Yes, ma'am. I am Dr. Rupavani.
You and Dr. Rupavani will present. Okay. So one more presenter has to be there. Who's that? Dr. Malti and Dr. Rupavani are presenting from the same group or different groups?
Hello, am I audible, ma'am?
Yeah, you're audible.
I am Dr. Rupavani from Blue Group.
Okay, so Dr. Malti is from another group. She will present.
I'm from Grey, madam.
Okay. So next will be Dr. Malti. Neha, I hope.
Dr. Tamkin, can I say something? Hello.
Yes, you can say.
Dr. Tamkin, I would like to apologize to you, to Dr. Rupavani and Dr. Malti, because I have to join a Cochrane collaboration meet. So please excuse me.
Okay.
There's a Cochrane collaboration meet, so I have to join that. It was really very nice to hear all that. Maybe I'll give some feedback once I get to slides or something. And thank you very much, and please excuse me. Okay.
Yeah.
Thank you.
And the competencies were nicely made. Yes, very clear about the different parts of a competency. Sorry, the SLO. Okay, so we move on to the next presenter, Dr. Rupa.
Yes, ma'am. Ma'am, are you able to see my screen?
I can see you. Are you on the slideshow mode?
Yes, Dr. Rupa, I can see it.
We can see you and your slide. Yeah.
So, ma'am, my competency is 4.1 and I'm from Blue Group. Yes, ma'am. So, shall I read out my competency, ma'am?
Yes.
Yeah. Yeah, the competency is describe and discuss the basic embryology of fetus, factors influencing fetal growth and development, anatomy and physiology of placenta, and teratogenesis. So the domain is knowledge domain, and the level of competency is also no competency, and it is a core competency. So we can take this topic in 3 classes, ma'am. 3 lectures can be taken for phase 2 student. So the first class will be on basic embryology and fetal growth and development. So one second. Yes, ma'am. At the end of session, the phase 2 student must be able to differentiate between ovulation age and menstrual age accurately. They must be able to distinguish the 3 periods, the ovular, embryonic, and fetal periods in the prenatal development according to the period of gestation. They must be able to discuss the stages of development in ovular and embryonic phases of life in correct sequence. They must be able to discuss the principal events in the development of major organ systems in the fetus in correct sequence. They must be able to identify at least 5 differences in the fetal circulation when compared to the adult circulation. They must be able to enumerate 4 changes that occur in the fetal circulatory system after birth. So this will cover the first lecture session. Then second session will be on anatomy and physiology of placenta. They must be able to describe the gross anatomical structure and histology of placenta accurately. They must be able to describe the development of placenta and the formation of chorionic villi in detail. They must be able to describe the establishment of uteroplacental and fetoplacental circulation in the placenta precisely. They must be able to describe the role of placenta as a barrier between the circulation, uteroplacental and fetoplacental circulation correctly. They must be able to discuss the 2 waves of extravillous trophoblastic invasion accurately. They must be able to relate defective trophoblastic invasion to the pathogenesis of preeclampsia appropriately. They must be able to identify the role of placental pathology in intrauterine growth restriction correctly. They should be able to describe 5 functions of placenta. They must be able to list 5 important hormones released from placenta. They must be able to discuss the role of HCG in the maintenance of pregnancy correctly. They must be able to discuss the role of monitoring HCG levels in pregnancy correctly. They must be able to list 2 functions of HPL. Then the third session will be factors affecting growth and development and teratogenesis. Student must be able to define teratogenesis, must be able to list 3 factors that can cause teratogenesis. They must be able to discuss the effect of teratogen factors according to the period of gestation. They must be able to categorize the drugs in pregnancy according to FDA and the amendment done in 2015. They should be able to list 5 viral infections that can cause teratogenesis. They must be able to list at least 5 major factors that can affect the growth and development of fetus. And they must be able to explain the role of nutrition in fetal growth and development appropriately. Yes, ma'am.
Hello. So any comments from the audience on this beautiful presentation by Dr. Rupa? Comments from the audience, please. Dr. Kavita. Dr. Kavita. Yes, please, Dr. Kavita. I unmuted you, Dr. Kavita. Please unmute and talk. Dr. Kavita, please unmute and talk. Dr. Rajshri, I unmuted you.
Hello.
Yeah, who's
I
that,
think
please?
the part, Dr. Aishri here. Good evening.
Okay, yeah. Good evening.
The part 2 and part 3 is very good, very nice. But in part 1, because already it has been covered in the first phase. So if we can do it just like a nesting or this thing for a teaching, I think that will be better. No need to, the time will be wasted for one session like that for the part 1 cellos.
So can we go back to the your slides, Dr. Rupa, what she's referring to?
Yes, ma'am. First session.
First session.
Yeah. Yes.
So I think that's a good idea from Dr. Rajshri.
Yeah.
Because it can
No,
be
I don't.
with vertical.
Yeah, it could be integration as well.
Yeah, it could be integration as well.
So can we go back to that slide, what she's talking about?
First one.
The first year or even backwards,
Yeah.
yeah.
But,
This is the first slide, ma'am.
Mm-hmm. 3
because
periods,
this all,
okay.
yeah.
Yes, you may continue, Dr. Rajshri, yes.
This,
Yeah, first slide. Yes, ma'am. Yeah.
yeah. So the 3 periods of development, prenatal development. So this will be already over in their first phase.
Yes.
So it can be just reinforcement.
So
Yeah, this is just.
So when we think, because you described that all this has to be covered in 3 sessions, that is why probably Dr. Rajshri is making
Yeah.
that comment. But
Yeah.
the SLOs
Yeah.
say like this only. What is when you decide on the teaching learning method? Like Dr.
Okay.
Rajshri pointed out, it could just, instead of going through all those SLOs, SLOs again, we just give them the SLOs and they come back prepared as home assignment. Just they revise or something like that, isn't it? So
Yes,
that is one method. Of any other ideas? So we can save 1 hour of that, isn't it? One whole
Yes.
session, because
One
they've
whole
already done.
session can be saved.
And it's very good that you divided all those SLOs into sessions, Dr. Rupa. You thought of that
Yeah.
also. That is also
Very
good.
nice. That was.
Yeah, very nice presentation. Yeah. On the slide on teratogenesis, can somebody improve on the first SLO that she made? I'm sure you must have thought a lot about the degree or whatever. The one on teratogenesis. Yeah. So anybody, because sometimes my mind is not working and somebody else's mind would work there. So the first is must be able to define teratogenesis. So the degree is missing there. Is there any standard definition of teratogenesis?
No standard
Anybody?
definition.
Yeah, this one. So the thing is
Hello?
that when you're making SLO, you have to go through the text yourself. You have to study that topic in detail. Yeah. Dr. Rashri, you want to say something?
There is no
Somebody?
standard definition.
Hello.
Yeah. Doctor?
I'm Dr. Kavita.
Yeah, Dr. Kavita.
I'm sorry, I think I interrupted. Somebody else wanted to speak. But the first SLO that she's written must be able to define teratogenesis. You are very right. There's no actual definition of which I can remember. If anybody
Neither
wants
can
to say how to define teratogenesis, will be difficult.
Yeah, that's why I did not put correctly or accurately. I did not put.
Yeah, so that's what I just wanted to demonstrate, that all SLOs will not fit into one particular model all the time.
Yes.
So that is that they do give us some idea about how to go about it in a standard manner. So any ideas from anybody else? Any more comments? Dr. Satinder, you are unmuted.
I think it was very good. and it was excellent. I don't think there was any loophole left.
Okay, so big hand for Dr. Rupa.
Thank you, ma'am.
Dr. Shobha is there. Dr. Shobha, you are unmuted now.
Yeah, can you hear me? Yeah, I am just looking at this category which has been used as A, B, C, D, and X as what we call it, the FDA category.
Yes.
In my understanding, there has been a new category which has been floated, isn't it? Apart from this.
Yes. Yeah.
So we discussed 3 methods. I have put the slides on the group as well. 3 methods which help us making SLOs. So probably you want to say it, we might use the other methods, and then it would fit into that.
Not about the methodology. I'm telling, no, the methodology is looking good only. I'm telling about the content, whether we need to use the latest classification of drugs, which is a little advanced one. I think it is not.
Okay, yes, you're absolutely right. What she's saying, must be able to categorize drugs in pregnancy according to FDA and amendment done in 2015. That's what you are talking about?
Yeah. It is called something. I'm not able to get it right now. I will post it in the group once I get it. That is the latest categorization. That is one thing. And there are very specific time zones during which teratogenesis is very likely. So, we say that probably between, if I remember well, between
there's a window period, when there is an all and none phenomenon, when either it will happen or it will not happen.
35 to 56 days or something like that. Between, or roughly say, if we speak in clinical terms of missed period, it is between the first and the second missed period, the effect of teratogenicity is highest. That is of clinical correlation.
What Dr. Shobha wants to say is that sometimes the competency is given as a something very broad, isn't it? So we need to, when you are formulating the SLOs, we need to know, assess whether all important points have been included or not. So it may not be part of the competency because it is something very broad that they have given, but the student should know, isn't it?
Yeah, am I heard or muted now?
No, you are heard.
Yeah. So I just wanted to say she has done a very excellent job, actually, very thorough job. Just wanted to say that some clinical correlations should come in. Otherwise, the candidate, reads it only as a matter of a theory, with patients, correlation does not come, because this is such an intensely detailed subject on, it's more like theory, but we need to give them clinical correlations very early. So I am unsure of how to bring it in. I just wanted to express that clinical correlations are important. So even as the young student starts reading, in his mind or her mind, the picture of the embryo and the mother and the clinical implications will start building, It will not be just a bookish knowledge.
Definitely.
I don't know how to bring it, how to express it better, but that is what I felt.
I think I understand. I get you. And another thing is that, for example, though it is not medical
context, it is better, is what I feel. Yeah. Thank you. Thank you for the time.
So if I
may I put in a point, ma'am?
Yeah, sure. Doctor? Who's the who?
I think Dr. Tripti wanted to speak.
So please introduce yourself and go ahead.
I'm
Dr.
Dr.
Tripti.
I made the previous presentation. It's just I'm reading the slide. Should be able to list 5 viral infections that can cause teratogenesis. I think would that be included in teratogenesis?
Why not? Yes.
Hello?
You have drugs, you have infections, you have environmental agents causing teratogenesis.
Okay, so that would also be included in.
Okay, she's right. Yeah, there are certain. And another thing is that what I want to, if I was just, you know, before the CBME curriculum and the competency was defined for us, if I wanted to introduce teratogenesis to an undergraduate class, I would definitely include counseling a patient who has come after, you know, they should be able to know that. How to counsel a patient who has already ingested certain teratogenic agent. So, and then the viral infections definitely we would include that. So I don't know, maybe it is coming somewhere with another competency. Maybe there's a repetition. Yeah.
Yeah, madam, it was a very good presentation by Dr. Rupavani, but can we add one SLO on prevention, madam? Because the student also should know how to prevent teratogenesis, for example, ACE inhibitors and all that, which they have to stop in the first trimester. Can we have one SLO on the preventive aspect?
Definitely, definitely.
Yes.
So that is the point, you know, that we that has come out of it, that it is always the whole department sits down, somebody thinks about somebody has one perspective, another person remembers something else more important, and also you have to have your textbook also in front of you, because maybe it is not part of that competency, or maybe you are not understanding it that way. So maybe you will leave something very important there. So just go through that textbooks in order to be able to make, you know, very relevant SLOs for that particular topic, for that particular competency. So any more comments?
Yeah, madam,
Yes.
the third SLO, I think because we know that teratogenicity happens only in the first trimester up to embryogenesis 7 to 9 weeks. So according to the period of gestation, I think we need to change that, no, madam, between 7 to 9 weeks only, because later it doesn't affect, the drugs won't affect.
Some will affect, but maximum it will be between that period. You are right. So they should understand that part.
Yes, ma'am.
You're right. Dr. Sabita. Dr. Sabita P. Dr. Sabita P, are you there? Please unmute and talk.
Am I audible, ma'am?
Yes, you are audible.
Hello. Yes, ma'am. Madam, somebody was mentioning about the prevention part should be added in this. But I feel that there is one more chapter is there regarding the preconception counseling. I think that prevention part will come in that chapter, I think.
So that is what I was saying, that we have not gone through each and every competency, and we have not formulated SLO for each competency. So once we, you know, formulate separately, we will all sit down together and see what we are missing and what fits in there. Your point, you know, yeah, I understand.
Because otherwise, again, the same thing is the repetition, which CBME wants to avoid, actually, redundancy.
Right.
Thank you, ma'am. Thank you, ma'am. And one more.
Yeah, sorry. Yes, Dr. Sabita, you are not
about the integration. Hello, ma'am. Am I audible? Yes, ma'am. Somebody was mentioning about the integration. I think more than integration, here we can use a nesting, ma'am, because more than an anatomist, we know better which period is more important in the point of our teratogenesis point of view. If you correlate with your ovulation period, like ovulatory age means, and embryonic age and fetal life, then the next topic is yours is the teratogenesis. Your correlation is better. So more than integration, I think it should be a nesting.
So What stage would you like to, deal with this? Which phase?
No, ma'am. First, regarding the first slide, somebody was mentioning about the integration. So the first topic is actually Dr. Rupavani has divided this into 3 topics. The first topic is we are it is not necessary. It is already covered in the anatomy classes. So we need not take this as a separate class. 1 hour we can save. But instead, or somebody was mentioning it can be integrated. Instead of integration, I feel it can be nesting. That means we will only taking the class, but we'll be taking the anatomy part. That's what actually I think Rupa's idea is probably.
So, but the anatomy people will be talking about it as well.
We need not have an integration for each and every topic, but we ourselves can take anatomy part in our class. That is only nesting, if I'm right.
Yeah, the thing is we don't want to compartmentalize,
Yes,
it has
ma'am.
to be MBBS curriculum as a whole.
Yeah.
So
because
when they are already taking it,
yeah, anatomists may be able to tell what exactly the different stages, but we will not know only the correlation with the future topics. So I think that will be deal with the obstetrician will be better than calling the anatomist. That's what I feel.
Okay. Dr. Sangeeta Rani.
Thank you, ma'am.
Thank you. Dr. Sangeeta Rani? No. Dr. Satinder. Dr. Kavita.
I think it was a wonderful presentation what she has done, and I think rest of the things which she has spoken is quite elaborate, and no further comments from my side as of now.
Okay, thank you. So can we move on to the next presentation?
Thank you, ma'am.
Yes. Thank you so much, Dr. Rupa. So Dr. Malti is the next presenter, Neha.
Yes, ma'am. Share. Madam, are you all able to see my screen?
Yeah, we are able to see.
May I proceed, madam? So I'm representing group 7 grade. My faculty is Dr. Kavita, madam. The topic given to me was normal and abnormal puerperium. The number of competencies are 4. 19.1 is the competency, it's a core one. The domain is knowledge and the level is knows how. That means I'll have to take the students up to the discussion and the analysis part. The competency I'm reading out, and most of my SLOs are framed by ABC format. Describe and discuss the pathophysiology of puerperium, its complications, diagnosis and management, counseling for contraception, puerperal sterilization. So I understood that I have to cover 6 components. So at the end of the interactive lecture session, the phase 3 part 1 learner, who is going to be the audience, should be able to define puerperium correctly, define puerperal sepsis. The synonymous word is puerperal infection correctly as per ICD criteria. List at least 6 predisposing factors for puerperal infection. This is again at the knowledge level. Describe the salient physiological changes in the genital, urinary and hematological systems of puerperium correctly. I chose these 3 systems because they are more important. So now the student is moving up to the level of understanding. There's a comprehension level. Describe the etiopathogenesis of puerperium infection correctly. discuss at least 8 preventive measures on puerperal complications correctly. Next, to the application level, correlate clinical features to its pathogenesis for making a diagnosis of puerperal sepsis correctly, classify the complications of puerperal infection and grade the maternal infection. When I thought of this classification, I wanted to teach them on the maternal and the neonatal complications and also mild and severe. So that is the classification that was there in my mind: maternal and fetal, mild and severe form of infection. Then categorize puerperal infection based on its signs and symptoms and the timing of presentation, because some of them they present on the second and third day, and venous thrombosis they present little later, that is 7 days later. So it was what was there in my mind was a puerperal infection based not only on the clinical signs and symptoms but also based on the timing of the presentation. This is the analysis level. Taking the same complication, but now SLOs are framed on the management aspect. Plan relevant investigations based on the given examination, clinical examination findings in a case of puerperal complication as per CDC guidelines. So the student is taken to the level of evaluation. Formulate a management plan by considering the clinical features, its severity, and the given lab results for the given 3 different case scenarios on puerperal complications as per the CDC guidelines. So here the student will be given the clinical features. He has to formulate the management plan based on the clinical features, whether it's mild or severe, so that and the lab results. And here 3 different case scenarios will be given, because we know the complications are multiple, so the most important ones will be picked up and the case scenarios will be framed. This is again at the evaluation level. The last is the create level, where the student has to compare and contrast the incidence of maternal deaths specific to puerperal sepsis in the various states of our country for the year 2019-20 using HMIS portal. This part I felt that only I will not be teaching this, but as a part of homework, so that formative assessment also can be done. But I'll be introducing to the students about this HMIS portal. Yeah, madam. The same competency has the counseling for contraception and puerperal sterilization. So here again, I'll start from the knowledge level. The student has to define counseling correctly as per the guidelines. Then moving on to the comprehension level, that is the understanding, discuss on at least 6 principles of family planning counseling effectively as per the guidelines. Discuss on at least 8 benefits of family counseling correctly as per the guidelines. Discuss on general and method specific counseling, because the general and the method specific counseling on contraception is quite different. So I thought it is important for me to teach them, have a discussion on general and method specific counseling for providing information on family planning services effectively as per the guidelines. Moving on to the analysis level, the student has to determine the client's medical eligibility criteria for the chosen method correctly as per WHO MEC wheel. So the student will be introduced on this usage of MEC wheel 2015, and the student has to determine to which category the client belongs to for the chosen method of contraception correctly. Then the create level, organize appropriate IEC material to conduct a counseling session on contraception effectively as per the guideline. So this is what I have framed for the first one, madam. Can I move on to the 19.2 competency, madam?
Are you going to? Okay.
Yes. So this is something, because in the first 19.1 regarding counseling, the student has learned the definition, the principles, the benefits, how to conduct a discuss on general and method specific, and also how to choose using the wheel the appropriate contraception. And also the student understood how important IEC material to conduct a counseling. So based on this, the 19.2 counsel in a simulated environment on contraception and puerperal sterilization. Here the level shows how. That means the student should be able to interpret, demonstrate a complex procedure requiring thought, knowledge, and behavior. So this would be at the end of a practical session. The phase 3 part 1 learner should be able to interpret because it's a psychomotor skill. I use the verb interpret the need of specific IEC material for counseling on contraceptive choices effectively as per the guidelines. Demonstrate counseling of an eligible couple requesting for contraception or sterilization, considering the varied cultural background effectively. Demonstrate proper use and disposal of male condom to the male partner on the given model correctly. Because this is madam, why I made this type of SLOs, because here it shows how, and it is belongs to the skill domain. So to the analysis level, identify at least 5 key components of effective counseling on the given contraception or puerperal sterilization during a field visit. Because in this competency, it is mentioned that there is a vertical integration with the community medicine department. So that's why I've framed this SLO saying that the student has to identify at least 5 key components of counseling, of effective counseling on contraception bar puerperal sterilization during a field visit correctly as per the checklist. Evaluation level, interpret the criteria for choosing contraceptive method from the given case details correctly, because earlier the student has learned how to use the WHO wheel. Now to the evaluation level, the student has to interpret the criteria for choosing the contraceptive method from the given case details correctly as per the WHO 2015 MEC guidelines. But the last one would be for the phase 3 part 2 students, that the evaluation level, measure the level of client satisfaction on the chosen method on Rubik's rating of 4 out of 6 using the checklist. The last part, 19.3, I think this is a third competency. 19.3, observe or assist in the performance of tubal ligation. Again, it's a domain, is a skill domain. So at the end of the clinical posting or a practical session, the phase 3 part 1 learner should be able to understand level, identify at least 6 important OT settings required for a tubal ligation procedure correctly as per the GOI guideline. Illustrate the parts of the fallopian tube and mark the ideal part for tubal ligation correctly as per the guidelines. Application part, the student should be able to present at the end of the practical session or the OT on 6 steps of surgical hand wash before assisting a case of tubal ligation correctly. Present the important steps of donning and doffing of surgical gown and gloves correctly as per the guidelines. Present at least 6 important surgical steps of tubal ligation surgery correctly. Present on safe disposal of biomedical waste at the end of the tubectomy surgery correctly as per the biomedical waste guidelines. Analysis part, interpret the given client details to decide on the eligibility for tubal ligation correctly as per the guidelines. This is for the phase 3 part 2 demonstration. Demonstrate at least one time the steps of postpartum and mini lap tubal ligation on the mannequin correctly as per the checklist. Record at least one time the steps of tubal ligation procedure done by 2 different approaches. Here what I thought is the student has to record at least one mini lap and one as a laparoscopic procedure done by 2 different approaches in the logbook correctly as per the checklist. So the student has been observing, the student has been presenting all this in the phase 1. Part 3, phase 3 part 1, but now the student has to demonstrate and also should be able to record this when the student moves to part 2. The last part, 19.4, enumerate the indications, describe the steps to insert and remove an IUD in a simulated environment. It's a skill domain again, and the level is shows how. So at the end of the practical session, phase 3 part 1 learner should be able to Enumerate at least 6 indications for IUD insertion in an eligible couple as per the WHO MEC 2015 guidelines. Enumerate at least 6 contraindications for IUCD insertion correctly as per the guidelines. Moving on to the level of comprehension or understanding, describe the steps of inserting IUD, because the steps of insertion is different for 380A and 375. I thought it's important for them to understand and describe the steps for IUD 380A and 375 correctly as per the checklist. Describe the steps of removing IUD correctly as per the checklist. Present at least 6 salient steps of insertion of IUD 380A and 375 correctly. Present at least 6 salient steps of removing IUD 380A and 375 correctly as per the checklist. Present at least 6 steps of safe disposal of waste following IUD insertion and removal correctly as per the biomedical waste management. Moving on to the level of comprehension or understanding, the student should be able to identify at least 3 indications and 3 contraindications for IUD from the given list of conditions as per the WHO MEC 2015. Illustrate the parts of IUD 380 and 375 in the logbook correctly as per the checklist. For the phase 3 part 2 student, application starts, that is demonstrate the steps of IUD on the mannequin correctly as per the checklist. Demonstrate the steps of removal of IUD on the mannequin correctly as per the checklist. Record at least one time one insertion and removal of 380A and 375 in the logbook correctly. And at the level of creation, organize a skill station to demonstrate IUD insertion and removal as per the checklist correctly. So I just try to apply the Meagher's format, madam. At the end of the practical session, learners will be able to demonstrate insertion and removal, that is the performance of 380A at the level of the fundus is the condition, in the mannequin accurately is the criterion. The Kern's method, by the end of phase 3 part 2, that is by when MBBS learner is who will be able to demonstrate, will do at least one time. How much? The appropriate technique as per the checklist, how well. After counseling the couple for IUD insertion, that is of what? On the mannequin. So I acknowledge, I sincerely thank all the faculty, and I have learned a lot from the group who helped me in learning these LOs, madam. But still, I know there'll be a lot of suggestions. I'm welcome. I will take up that and modify further, madam.
So can we have the last slide, please? That's a beautiful slide, Dr.
Malti.
Dr. Malti. Yeah.
Yes, madam.
The last slide is really beautiful.
Yeah, the last slide is the one from where I've learned from you, madam. You have shared in the group. I tried to put it in this format.
These two are very good methods for psychomotor domain, isn't it? You must have, I mean, you have just demonstrated how well they work here. So Dr. Asha Mishra, comments from you. I have unmuted you.
Presentation. Very beautifully presented, in fact. But I just wanted to know, do we have to tell them all the biomedical waste, donning, doffing every time, because it's done everywhere, in every domain, in every other department also. So that disposal of waste is the part of the microbiology. So everything beautifully said.
So any comments for Dr. Asha's query? Yes.
Can I say something?
Yes.
Yes.
Dr. Asha is very correct, because I think this makes it very, very elaborate when we talk about how to don and how to doff, and every time talking about biomedical, because we have to concentrate on contraceptive right now in the puerperal phase. So then it becomes very extensive if you take it every time in each competency.
But
yes, I agree.
Some more comments, please. Dr. Manjeet, I unmuted you. Dr. Manjeet, You are unmuted, please. Go
Yes, I'm
ahead.
speaking. Okay. I just wanted to clarify whether are we supposed to tell 380 and 375 separately? I think our students, they're putting whatever is available. It may be multi-load or it may be 380A. So to write down separately and to record on logbook separately, is it important?
Madam, the
So,
technique is different. So
the
I thought
technique is definitely it is definitely different, but the thing is that if you ask them to do the learn both and demonstrate both, so for MBBS it becomes Dr. Malti, you have made very comprehensively, you have covered each and every aspect. But remember, whenever we talk about competencies, they have to be smart, which means they have to be achievable. So like Dr. Asha pointed, and that we don't need to repeat. So if you tell, when I'm actually performing the session, I'm actually taking the session, or when I'm using the checklist, definitely I'm going to use the, I'm going to teach them about the aseptic technique, and I'm going to emphasize on BMW part. But again, the problem of the repetition is there. So whether it should be part of the SLO, a separate SLO, or whether we can just say using all aseptic techniques and following BMW principles.
Madam, can I ask you one doubt?
Yeah.
Madam, when we are teaching AMTSL on the mannequin, it also emphasizes on hand wash, the steps they'll have to demonstrate, and how to dispose all that biomedical waste, the placenta in yellow and all that. Because in AMTSL, again the biomedical waste comes in, the hand wash comes in, and that is how the checklist is framed. So I was under that impression when we teach on the practical side, each point becomes important because that is mentioned in the checklist.
So if something is there in the checklist, that doesn't mean that it has to be a separate SLO.
Okay.
That is what Dr. Asha was pointing out. That is because if you have a separate, definitely I would say it is the most important part of all procedural demonstrations that you do for a normal delivery, for a third stage, for every procedure that you do, it is important. So you can just add a word, all aseptic precautions, and rather than have them rather than making a separate SLO, that they should be able to demonstrate the all aseptic precautions, they should be able to demonstrate that they did the okay. So it's part of that. And,
So demonstrate steps of IUD insertion, adhering to the principles of how to frame, madam. I am not
adhering to all principles of standard infection prevention practices and BMW management.
Okay, ma'am.
Okay, and that is going to be the and also when you are talking about some more, I'll talk later on. Any more comments? Yes, Dr. Shobha. I'm unmuting you. Yeah. Dr. Shobha.
Thank you, Dr. Tamkin. Thank you for the time. And I must compliment Dr. Ponnuru. Excellent presentation. I can say because I'm currently doing the committee work in FOXY as chair of Family Welfare Committee.
Thank you, madam.
These details are very well brought out. There is only two concerns in my mind, because I think there are a lot of experts who will bring out the finest in the final product. But two concerns. One is when we are talking about preterium, when the counseling is going on, we have to tell them about the counseling for lactation also. We have to include that in this competency for breastfeeding. Important. Has that been left out, or is there any other program for that, any other competency for that?
Maybe there's another one, but Dr. Malti, I also noticed that you restricted yourself to the genital tract, the urinary tract, and one more system. But
yes, madam, one more competency which is talking on mastitis, lactation, breast abscess and all that. That's
So
why I
that is
didn't touch.
So probably there is another, that's what I thought, that maybe there is one more competency, that's why she has left out.
As you
The
said, madam,
second part,
you will have to read before framing the SLOs. So I just went around and then I found one competency on lactation. That's why I eliminated that.
Fine. Then that will be dealt with there. Only thing is, it will be good if we can have an integration on this. When students are taught, we cannot teach them in a segmented manner puerperial care. We have to give them a list of the entire content of puerperium or postnatal care in one place, some place. You have to give either in the lactation lecture or this lecture. They have to know how many parts are there in postnatal care. The other thing I think, that is the first point. The second point, I'm sorry I'm bringing this up, but I think there are clinical inputs of good ambulation and good hydration in the postnatal care. In some way that can be included. The third point is, I must say, Malti, that beautifully you have brought out, but the details of contraception service provision and counseling actually are of a postgraduate level in your presentation. Undergraduates should be given the, I think, the concept and the correct methodology of IUCD insertion, the principle of it. But to tell them about different devices may not work this early on, is what I feel. And so also the mannequin demonstration of tubal ligation. Everybody has spoken about universal infection prophylaxis can be dealt with in just one place, any one place, and it need not be necessarily here. But the tubal ligation also, I think if the checklist is followed, it is enough. I think there is one thing which is essential is to bring in family welfare a very brief word about Government of India guidelines which are governing these practices. So they will be required to know about ACHA and the incentivization and indemnity very, very briefly. It need not be as detailed as for postgraduates, but they need to know that all these services are under the GOI umbrella. That is very important.
Madam,
Thank you so much for the time, champion. Thank you.
Madam, one competence on contraception, 21.1. I think that's a lecture knowledge and knows how. I felt that would be covered in that competency, so I didn't touch upon that GOI guideline.
Fine. No, here I thought that we need to give the concept rather than too many details, because it's very overwhelming for the students to have so much of detailing on each IUCD insertion and all. So let us have the concept of an intrauterine device placement and the aseptic precautions. And as interns, they will have to be trained, of course. But when they are learning, I think we need to tone down on the detailing is what I felt. So also the same about counseling. I think they will not be kind of so much, they may not be able to acquire that greater knowledge to counsel method specific, for example, because counseling is something very, very intricate and it is a very difficult thing to master. So they should not feel dejected or anything. So we should give them very, very brief inputs on these matters. Thank you. Yeah.
So thank you, Dr. Shubha, for you are doing a lot of work on the contraception and yeah, Dr. Tipti, you want to add something? No. You have more.
Just one comment.
Yeah.
Just one comment. It's a very beautifully prepared comprehensive presentation. I just wondered whether in the beginning of those SLOs we should add one learning objective on the causes of fever in the puerperium, and then go on to discuss puerperal infection, because fever is very important in puerperium, and there can be so many causes.
What I know, what I noticed in her, SLOs on puerperium, that she was very much, stressing on infection, the complication of infection in puerperium. So,
so
most of
infection,
her SLOs are related
fever,
to, in fact,
fever could be
complications.
due to so many other causes. So before we go on to discuss puerperal sepsis as such, we could teach them there are so many other causes of fever in puerperium. They need to be excluded as well.
Yeah, must be able to evaluate a woman with fever in puerperium. That would be a very relevant SLO for these. And Dr. Balti, you have made very comprehensive, very detailed. But I also felt just like Dr. Shobha, because whenever you're making those competencies, if you just keep that in mind, like Dr. Rupa, how many hours you want to devote to that, then you'll be able to, just have a very achievable, type of SLOs. So that is very important, that you need to think in terms of how many hours. Once you make the SLOs, you think in terms of, how many hours you will need, you will require for completing those SLOs. That is very important. And one more thing here, you can just revise all these SLOs. They are so comprehensive, and group them together, club them together, so they will become simpler. And one more thing is that I also agree with Dr. Shobha, like two methods of, copper T. So because 380A is part of the government, we can just concentrate on that. And then you said two methods of puerperal ligation, mini lap, and two methods of tubal ligation. So again, we have to remember that it should be achievable in a batch of 150 to 250 students, when the aim is that he should either observe or assist.
Yes, observe or assist.
So again, it has to be maybe during internship he'll be able to do that. But for a phase 3 student, part 2 student, I don't think so, because we'll be able to,
But our students in the records, they write both the methods, madam, because we have 10 to 12 cases per day. Out of them, half of them would be PNS and half would be laparoscopic. So that was there in my mind.
So it is not the same everywhere.
Okay, it has
So
the same
whenever we are talking about standardization, so it should be something real and achievable by all.
Yes,
so definitely they should understand what is a mini lap and how to do that. But writing and observing and then putting it in the logbook. Logbook means that they have done it, isn't it? It's a log of the activity. Dr. Seema, are you there, Dr. Seema? I am unmuting you. You wanted to, ma'am? Seema ma'am, आपका हाथ उठा हुआ था. So, Dr. Seema,
when we were discussing about biomedical waste management, doffing, donning, as IUCD insertion is a certifiable skill, I think we should focus on doffing, donning, and biomedical waste as well in this competency. Otherwise, like for every competency, especially which is dealing with surgical competencies, donning, doffing is there. But everywhere, yes, we can say that strict infection prevention practices will be followed or something like that. But for certifiable, I think we make them revise it again and again, because they are going to work as a JR. And what we are facing, that when we don't make them realize that these are very important and it comes into their habit. So to bring into their habit all these biomedical waste management, I think it is a reasonable thing to do it when they are doing the certifiable skill. For rest, we can say that infection prevention practice should be followed.
Definitely, it has to be part of the checklist. But what we're thinking, why we were saying that, but we do not want duplication of the SLO.
Exactly.
So part of the SLO. Yeah, it
it cannot be the part of SLO, but we should remember that when we are doing the certifiable skill, we should make them do this.
So it has
At
to be
least
part of the
when we
Yeah,
are certifying those skills.
Yeah.
Hello,
Definitely.
can I comment?
Yeah, Dr. Hemant, I unmuted you. Yes.
Yeah,
Yes.
I want to draw one attention that SOP or standard operating procedures and SLOs, there is a thin line in between them. Now, the government and the health system demands that even non-doctors put IUCDs, like sisters and field workers, they put IUCDs. Even they have the proper training and checking. So I think including sterilization, biomedical waste is very, very important and must be included in the standard operating procedures. And in the competencies, you can write that aware about the biomedical waste. One line will be good enough. What is your take? I don't know. But I think when you make a standard operating procedures, this should be even before that. Many times in the Western countries, the doctor has to greet, introduce himself. These are the standard operating procedures there.
So you're right, Dr. Damle. It has to be part of the learning guide. It has to be part of the checklist, and it has to be part very important step on which you assess the student.
In the SLO, you can just mention that awareness about the contraception, awareness about the biomedical waste. But when you write SOPs, standard operating procedures, and when you assess that candidate, depending on the level of assessment, whether you are an undergraduate student or intern or postgraduate student, this variation may occur, but it should be a part of the SOP.
When you use the word awareness, Dr. Malti, would you like to reply to that? Or Dr. Shobha, you would like to reply to that? It cannot be awareness for an undergraduate.
It cannot be an.
She's very passionate about, Dr. Malti, I think you are the best person to reply because you're so passionate about standard precautions, infection prevention precautions, and biomedical waste management.
Yeah, madam. Awareness cannot be measured, and whatever SLO we frame, it should be. We should be at the end. We should be able to assess evaluation. So SLO cannot be framed starting with awareness.
So they should be able to demonstrate that they are following standard infection prevention practices, as well as they are able to perform the proper biomedical waste management, following the principles of biomedical. Yes. So yes. Anybody else would like? Yeah, Dr. Kavita, you would like to comment? So it is 8:58. Dr. Kavita?
The first slide I wanted to comment because she has written define puparium. And then probably she can put in one line and list the complications of puparium. Because besides infection, as you said, there are several other causes and problems in puparium. So I thought that was missing. So if we can list the complications during puparium.
Yeah, when we are making SLOs, I think again I would advise everybody to go through the book. Even after you have made the SLO according to the competency, you have made exhaustive, and very comprehensively, you have included all those topics, but still, please remember that you need to look at the book or what you have been teaching. If you have notes, well and good. You have been covering the subject. You are all experienced teachers. So just to see, like Dr. Shobha was again and again emphasizing on the clinical aspects. So just go through your own notes or the book and just see whether every aspect has been covered or not. So thank you, Dr. Mark. Thank you everybody for so many, for your experience sharing and your comments. Can we just call it a day now?
Yes, madam. Thank you so much, madam. I'll modify and then share it in the group.
Okay. And then we'll have a whole completed thing, and we'll put up what all on all websites. Everybody can use it. So
Yes,
now I
madam.
just wanted to know the next session is going to be on Saturday 9th.
Yes.
Okay. Okay,
Yes,
then
yes.
bye. Good night,
Bye.
everybody.
Thank you. Good night.
Bye.
Thank you. Good night.